Hello, Dr. Emilio Castrillon here, and I want to explain some amazing results that we have with this patient. This is the patient of the week, in which we started with this patient with 5 different scoliosis, okay? So one dextroscoliosis, 10 degrees, and then another level scoliosis, 8 degrees in the mid-lumbar area, okay? We are talking about this region right here, these 5 vertebrae having 2 different scoliosis, 1 and 2, and then in the thoracics, another one from thoracic number 10 all the way to thoracic number 8, 1.4 degrees, and then another one from thoracic number 8 all the way to thoracic number 6, that was 8 degrees as well. Also, we have a 3.4 degrees scoliosis, dextroscoliosis on the cervical area in the neck. But then in this case, this is how we started. Patient had different situations, different type of symptoms, even lack of control of different functions in his body, just for these little misalignments and scoliosis. Scoliosis, just to give a brief review about what is that. Normally it should be, everything in the spine should be straight, and in reference to this point right here, that is called the spinous process, that is supposed to be completely straight on the green line right here. But then whenever we have a curvature leaning these ways, we need to find where the problem starts and where the problem ends. So in that way, we find 4 scoliosis, 2 in the thoracics, 2 in the lumbars, and 1 in the cervicals. We started working with this patient. He was committed to work and do the things that we need to do. There are things that the patient needs to do at home. This is a team effort, okay? It depends on the results you want to get. If you want to get just the pill type of result, so you're going to be on pain. You're going to be going to the chiropractor just to keep going to the same thing. So every time you have pain, is that you're going to find a solution. It's going to be a temporary patch on top of your situations. But after you have a specific assessment about what is going on, you want to correct this so you can enjoy quality of life. That is the key. You need to enjoy your quality of life. You can enjoy any activity with your kids, any activity with your loved ones, any type of functions. You don't have restriction. The mindset is very different. Whenever you can do whatever activity, you are just cautious about protecting your health instead of having a restriction. If you already have a restriction for any healthcare provider telling you you cannot do this and this and this, you're automatically gonna start feeling you are old, you are crippled, you are not gonna be performing in life, and that start making you old in your brain, in your mind, in your thoughts. So it's super important, depends on the assessment and the approach you want to accomplish. In this case, this patient wanted to compromise himself to correct all of this. And this is what we got after a few months, after working correctively with him. After 5 scoliosis, he only have 1 more to go. And you know how much is that big? How big is that one? 3.5 degrees only, right here in the lumbar area. This one, that was initially 10 degrees, and now it's only 3.5 degrees. And how this happens, how this type of results can happen, is because of this. We need to pay attention to the foundation. That was tilted 2 millimeters here and having other issues on the foot as well. We need to review everything from the foot. Why? Because the feet are the foundation of the entire building. If that building is tilted in one side, crooked, weak in one side, one knee is affected, something is tilted, or there is torsion on the pelvis, there is nothing that is going to hold above, and the body is going to start creating all of these compensations because of whatever is happening from the foundation. So in our focus, we focus on that foundation, then we can keep building on top, and that is going to have long-lasting results. It's going to give long-lasting results. And that's what we are getting in here. This patient is not with 0 symptoms right now, and he is just improving little by little with the other stuff that is going on. But then the amazing thing is the other scoliosis, they are gone, including the cervical one. It's completely straight. And that is the way to heal an scoliosis. So scoliosis depends on the situation and the person as well. It can be healed. That's what we see here every day. Every day we are seeing here people healing, and even how that happens is because we are paying attention to everything from the foundation. And then we are just excited. This patient is just a few more things to go, but this is the way that we can explain to our patients the body wants to heal. The body is not stupid. The body knows very well what to do and how to do it, and this person is doing it. And this is an example of everybody. The body has something that is called the innate intelligence. That innate intelligence tells the body how and what to do to regulate, repair, and heal anything that needs to be healed. So, another example about how the body works amazingly towards healing, and we are waiting for you. You need to be evaluated. Don't guess with your health. Your spinal health through the nervous system controls every single function in your body. If you are not paying attention to that, you are missing a big time right there, because this is key. This is super important. So be evaluated. We are in Tampa, Florida, helping our patients to get the best life they can. And that's how it is, starting by screening and checking everything. So you can call us to our phone numbers to make sure you have the appointment to be evaluated and start getting amazing results that we are having with other patients. So have a blessed day, and thank you so much.